posibleng tanong na lumabas ngayong darating na Philippine Nursing Licensure Examination ang alay ko sa iyo for today. Board exam type of questions with rationalization that will cover your foundation of nursing practice. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals with their studies. If that is something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos every week. Don't miss that out. Subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more content like this. Without further ado, let's jump into the video, nurses. Hi everybody! Welcome back nga sa ating channel. Hindi lang sa ating YouTube channel, dito sa Team Kulto, pati na rin sa ating Facebook page. Maraming salamat po for making that happen and for trusting me. Na ang video na to ay naalay ko sa lahat ng mga test takers ngayong darating na May. Philippine Nursing Licensure Examination nga po is coming. I'm starting this series on my channel where I'm actually trying to help you out in preparing for the nursing board exam. Today, I'm serving you board exam type of questions with rationalization that will cover your foundation of nursing practice. PNLE 1 nga po. Kung di mo pa napapanood yung very first entry natin, yung video na ginawa ko where I give you 50 board exam type of questions with rationalization. Ililink ko yung actual playlist dyan kasama ng ibang mga videos at kasama ng iba ng mga playlist na ginawa ko for nursing education. Hindi ko na patatagalin to. Ilaban na natin to. Now, in order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit.
Alright, hi everyone. Welcome back sa ating formal discussion ng Foundation of Professional Nursing Practice. This is another entry natin sa ating nursing test bank. Oo, kasi nalalapit na ang ating Philippine Nursing Licensure Examination sa Pilipinas. Meron tayo ngayon sa mga May test takers. Ito, sana hinahabol ko po itong content sa channel ko para makatulong sa mga magte-take ng board exam ngayon darating na Mayo. Huwag kayong mag-alala kasi dadagdagan pa natin to. Hopefully, mas marami tayong mas magawa para mas pagdating mo ng board exam ay talagang ready ka na. Ngayon, kung hindi mo pa napapanood yung mga previous videos na ginawa ko sa nursing test banking, kinover ko na rin tong Foundation of Profession, yung PNLE 1 natin. Meron ako niyan parang 1 hour video ata yon. But this time, I'm trying to make it shorter para hindi ka masyadong naboboard. Tsaka ang hirap niya talagang i-shoot, moms, parang discussion talaga siya. Kaya sabi ko, ililink ko yung actual playlist na yun kasama ng mga iba nating nursing educational content sa icon button. So kapag nag-pop out yung icon button or i-check out mo yung description box, please, because lahat ng mga links ay naandon. At wag mo na rin kalimutan ang mag-subscribe sa channel ko pa at i-hit yung notification bell para lagi kang updated sa mga post natin. Now, hindi ko na patatagalin pa. Ito na talaga. Objectives natin, well, gaya ng dating gawe, I will provide you and discuss to you board exam type of questions. Then I will also going to provide you rationalization per each board exam type of questions. Let me give you the instructions, okay? How this discussion goes. You will be given 25 board exam type of questions. I will be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Nurses, choose the letter of the correct answer nga po. Good luck. Handa ka na ba? Hinga-hinga. Let's begin. Board exam type of question number 1. When caring for a male client with a 3 centimeter stage 1 pressure ulcer on the coccyx, take note, 3 cm stage 1 pressure ulcer saan matatagpuan sa coccyx. Which of the following actions can the nurse institute independently? Independent nursing action ang tanong. Independent nursing action. Is it A, massaging the area with an astringent every 2 hours? Is it B, applying an antibiotic cream to the area 3 times per day? C, using normal saline solution to clean the ulcer and applying a protective dressing as necessary? D, using a Povidone iodine wash on the ulceration 3 times per day. Your 5 seconds starts now. Alright, time's up. The answer is letter C. Using normal saline solution to clean the ulcer and applying a protective dressing as necessary. Washing the area with a normal saline solution and applying a protective dressing are within the nurse's realm of interventions and will protect the area. Using a Povidone iodine wash and an antibiotic cream require a physician's order. Kaya naman, that's what this is. Kapag may iba nang involved na healthcare professional. Ano yon? Itong B ay more on collaborative care. Massaging with an astringent can further damage the skin. So this is a big no-no. Kasi nga ulcerative, maglalagay ka pa ng astringent. Gigigil ako sa iyo. So the answer is C. Board exam type of question number 2. Nurse Oliver must apply an elastic bandage to a client's ankle and calf. He should apply the bandage beginning at the client. So sa pag-a-apply daw ng bandage, ng elastic bandage na sa na to, saan magsisimula? Kapag ang area mo ay ankle and calf. Gets? Is it A, sa knee, ankle, lower thigh, or foot? 5 seconds starts now. Time's up. The answer is letter D, foot. Why? An elastic bandage should be applied from the distal area to the proximal area. This method promotes venous return. In this case, the nurse should begin applying the bandage at the client's foot. Beginning at the ankle, lower thigh, or knee does not promote venous return. Let's proceed. Board exam type of question number 3. A 10-year-old child with type 1 diabetes developed diabetic ketoacidosis and receives a continuous insulin infusion. Which condition presents greatest risk to this child? Risk. Sa batang 10-year-old na merong type 1 diabetes. Alright, is it A, hypernatremia? Is it B, hypokalemia? C, hyperphosphatemia? Or D, hypercalcemia? 5 seconds starts now. Time's up. The answer is letter B, hypokalemia. K, potassium to ha. Insulin administration causes glucose and potassium to move into the cells, causing what? Hypokalemia. Period. Board exam type of question number 4. Nurse Len is administering sublingual nitroglycerin or nitrostat. Familiar sa concept ng nitroglycerin mo? Okay, hala, typographical, kulang ng O. Now, immediately afterward, the client may experience. So, immediately afterward, tinatanong ka ng side effect ng nitro. Is it A, throbbing headache or dizziness? Immediate ha? B, nervousness or paresthesia. C, drowsiness or blurred vision. D, tinnitus or diplopia. Your 5 seconds starts now. Alright, the answer is letter A. Throbbing headache or dizziness. Headache and dizziness often occur when nitroglycerin is taken at the beginning of therapy. However, the client usually develops tolerance. Alright? Next. Board exam type of question number 5. Nurse Michelle hears the alarm sound on the telemetry monitor. The nurse quickly looks at the monitor and notes that the client is in a ventricular tachycardia. The nurse rushes to the client's room. Upon reaching the client's bedside, the nurse would take which action first? Initial action mo kapag na-notice mo na ang pasyente mo ay naka-ventricular tachycardia. Ano una mong gagawin kung ikaw si Nurse Michelle? Is it A, prepare for cardioversion? B, prepare for defibrillate? Prepare to defibrillate the client. C. Call a code. D. Check the client's level of consciousness. Your 5 seconds starts now. Time's up. The answer is letter D. Check the client's level of consciousness. Determining unresponsiveness is the first step assessment action to take. When a client is in ventricular tachycardia, there is a significant decrease in cardiac output. However, checking the unresponsiveness ensures whether the client is affected by the decreased cardiac output. That's why checking for level of consciousness. Alright? So, sana ma-appreciate mo yung mga visuals na nilalagay ko dito kasi I'm really trying to make it colorful, vibrant, and somehow may mga information sa mga binibigay kong mga visuals dyan or related doon sa tanong para magkaroon ka ng visual representation. Makakatulong to para sa mga visual learners and of course, my beautiful, gorgeous voice sa mga auditory learners natin. Charing! Okay, proceed na tayo. Galaw-galaw, hinga-hinga, nakakahinga pa ba kayo? Ito na. Question number 6. Nurse Hazel is preparing to ambulate a female client. The best and the safest position for the nurse in assisting the client is to preparing to ambulate. Ambulation ang tanong. A. On the unaffected side of the client. B. On the affected side of the client. C. In front of the client. Or D. Behind the client. I'm gonna give you 5 seconds and it starts now. Perfect. The answer is letter B. On the affected side of the client. When walking with clients, the nurse should stand on the affected side and grasp the security belt in the mid-spine area of the small of the back. The nurse should position the 3 hand of the shoulder area so that the client can be pulled toward the nurse in the event that there is a forward fall. The client is instructed to look up and outward rather than at his or her feet. Alright, gets yon? Gets. Alright, next question. Nurse Jana is monitoring the ongoing care given to the potential organ donor who has been diagnosed with brain death. Brenda na to. Oh, no. The nurse determines that the standard of care had been maintained if which of the following data is observed. Is it A, urine output of 45 ml per hour, B, capillary refill of 5 seconds, C, serum pH of 7.32, or D, blood pressure of 90/48 millimeters of mercury? Your 5 seconds starts now. Alright, the answer is letter A. Urine output of 45 ml per hour. Adequate perfusion must be maintained to all vital organs in order for the client to maintain visible as an organ donor. A urine output of 45 ml per hour indicates adequate renal perfusion. Low blood pressure and delayed capillary refill time are circulatory system indicators of inadequate perfusion. A serum pH of 7.32 is what? Acidic, which is adversely affects all body tissues. Alright? So malinaw yon. Proceed. Board exam type of question number 8. Nurse Amy has an order to obtain a urinalysis from a male client with an indwelling urinary catheter. Anong situation mo? Merong indwelling catheter ang iyong pasyente. Anong gagawin niya? Obtain what? UA samples. The nurse avoids which of the following which contaminate the specimen. So ang tanong, ano dito, alin sa mga options na to ang magko-contaminate sa pasyente mo o dun sa specimen? Is it A, wiping the port with an alcohol swab before inserting the syringe? B, aspirating a sample from the port on the drainage bag? C, clamping the tubing of the drainage bag? Or D, obtaining the specimen from the urinary drainage bag? Your 5 seconds starts now. Alright, the answer is letter D. obtaining the specimen from the urinary drainage bag. Why? A urine specimen is not taken from the urinary drainage bag. Urine undergoes chemical changes while sitting in the bag and does not necessarily reflect the current client status. In addition, it may become contaminated with bacteria from opening the system. That's why the answer is letter D. Let's proceed. Board exam type of question number 9. Nurse Mary Death is in the process of giving a client a bed bath. Anong situation? Giving the patient a bed bath. In the middle of the procedure, the unit secretary calls the nurse on the intercom to tell the nurse that there is an emergency phone call. Habang nagpapaligo, biglang may tumawag, mayroon daw emergency call. The appropriate nursing action, kapag gano'n, nasa sitwasyon ka ng gano'n, o nandun ikaw si Meredith at nandun ka sa sitwasyon na yun na nagpapaligo ka, biglang may emergency call. Ano ang gagawin mo? Ano ang best action mo? Is it A, immediately walk out of the client's room and answer the phone call? Ang saya. B, cover the client, place the call light within reach and answer the phone call. C, finish the bed bath before answering the phone call. D, leave the client's door open so the client can be monitored and the nurse can answer the phone call. Nurse says, umayos ka. 5 seconds starts now. Okay, the answer is letter B. Cover the client, place the call light within reach, and answer the phone call. Because telephone call is an emergency, the nurse may need to answer it. The other appropriate action is to ask another nurse to accept the call. However, it is not one of the options. To maintain privacy and safety, the nurse covers the client and places the call light within the client's reach. Additionally, the client's door should be closed or the room curtains pulled around the bathing area or bathing area. All right? So, let's proceed. Nurse Jana is collecting a sputum specimen for culture and sensitivity testing from a client who has productive cough. Nurse Jana plans to implement which intervention to obtain the specimen. In obtaining the specimen daw sa ating culture and sensitivity, ano ang gagawin ni Nurse Jana? Implementation mo. Is it A, ask the client to expectorate a small amount of sputum into the emesis basin? B, ask the client to obtain the specimen after breakfast? C, use a sterile plastic container for obtaining the specimen? Or D, provide tissues for expectoration and obtaining the specimen? Masyadong komplikado. 5 seconds starts now. You know what, sometimes sa board exam, common sense at yung pinakasimple na option, yun yung sagot. Huwag mo na masyado mag-overthink ha. Minsan yung instinct, i-follow yun. Nurses, malaking napakalaki. Totoo yun. First answer that comes to mind, yun na yun. Huwag nang magpapalit ka lang kapag talagang sure na sure ka at meron kang basis. Yun yan. So the answer to this is letter C. Diba? Use a sterile plastic container for obtaining the specimen. Bakit? Kasi nga culture and sensitivity. Ito papaliwanag ko sa'yo. Sputum specimens for culture and sensitivity testing need to be obtained using sterile techniques because the test is done to determine the presence of organisms. If the procedure for obtaining the specimen is not sterile, then the specimen is not sterile. Then the specimen will be contaminated and the results of the test would be invalid. Alright? Galaw-galaw. Medyo nakaka-halfway through na tayo. So, board exam type of question number 11. Nurse Ron is observing a male client using a walker. The nurse determines that the client is using a walker or the walker correctly if the client correct, anong tanong dito? Correct usage of walker. Is it A, puts all the 4 points of the walker flat on the floor, puts weight on the hand pieces, and then walks into it or into it. B. Puts weight on the hand pieces, moves the walker forward, and then walks into it. C. Puts weight on the hand pieces, slides the walker forward, and then walks into it. Or D. Walks into the walker, puts weight on the hand pieces, and then puts all 4 points of the walker flat on the floor. 5 seconds starts now. Nalito ka ba? Huwag ka makilalala. Balik-balikan mo lang ito, ha? Ito, papaliwanag ko sa iyo. The correct answer is letter A. Puts all the 4 points of the walker flat on the floor, puts weight on the hand pieces, and then walks into it. Why? When the client uses a walker, the nurse stands adjacent to the affected side. The client is instructed to put all 4 points of the walker 2 feet forward, flat on the floor before putting weight on the hand pieces. This will ensure client safety and prevent stress cracks in the walker. The client is then instructed to move the walker forward and walk into it. All right? Let's proceed. Board exam type of question number 12. Nurse Amy has documented an entry regarding client care in the client's medical record. When checking the entry, the nurse realizes that incorrect information was documented. How does the nurse correct this error? So napansin mo na may error sa documentation. Paano mo siya i-correct as a nurse? Is it A, erases the error and writes the correct information? Nako. B, uses correction fluid to cover up the incorrect information and writes in the correct information. Subukan mo. C, draws one line to cross out the incorrect information and then initials the change. D, covers up the incorrect information completely using a black pen and writes in the correct information. Your 5 seconds starts now. Nursing charting. Anong sagot mo dito? Sasapukin kita. Letter C is the right answer. Draws one line to cross out the incorrect information and then initials the change. To correct an error documented in a medical record, the nurse draws one line through the incorrect information, then initials the error. Diba ginagawa natin ito sa area, mga nag-OJT dyan, or kahit na mga registered nurse na, ganito tayo correct. So kung mali ito, let's say for example, mali ito, mali hindi mo dapat susulat, linyahan mo, and then signature sa taas. You can also put open and close parentheses, linya, signature sa taas. Ganon. Standard yon. Kayong ano dyan. An error is never erased and correction fluid is never used in the medical record. Subukan mo. Board exam type of question number 13. Nurse Ron is assisting with transferring a client from operating room table to stretcher. Client transfer. To provide safety to the client, the nurse should A. Moves the client rapidly from the table to the stretcher. Rapidly. Word of extremes. Tandaan mo yan sa board exam. Pag may mga choices na may word of extremes, medyo magduda ka. B. Uncovers the client completely before transferring to the stretcher. C. Secures the client's safety belts. Secures the client's safety belts after transferring to the stretcher. Or D. Instructs the client to move self from the table to the stretcher. Operating room nga, di ba? Papunta sa operating room. Ay, galing sa operating room, papunta sa stretcher. Ano ba talaga, girl? Okay, your 5 seconds starts now. Alright, time's up. The answer is letter C. Perfect. You got that right. Secures the client's safety belts after transferring to the stretcher. During the transfer of the client, after a surgical procedure is complete, the nurse should avoid exposure of the client because of the risk for potential heat loss. Hurried movements and rapid changes in the position should be avoided because these predispose the client to hypotension. At the time of the transfer from the surgery table to the stretcher, the client is still affected by the effects of the anesthesia. Therefore, the client should not move self. Safety belts can prevent the client from falling off the stretcher. Malinaw yon? Malinaw. Board exam type of question number 14. Nurse Mirna is providing instructions to a nursing assistant assigned to give a bed bath to a client who is on contact precautions. Contact precautions. Anong sitwasyon? Nagbe-bed bath. Nurse Mirna instructs the nursing assistant to use which of the following protective PPEs when giving bed bath. Anong PPE? Ang simple lang ang tanong actually, binigyan ka lang ng storya. Anong PPEs ang gagamitin mo kapag nag-bed bath ka sa pasyenteng under ng contact precautions? Is it A, gown and goggles, B, gown and gloves, C, gloves and shoe protectors, D, gloves and goggles? Your 5 seconds starts now. Time's up. Malinaw na madaling-madali lang to, nurses. The answer is letter B. Gowns and gloves. Let me explain to you why, just in case you've forgotten. Contact precautions require the use of gloves and gown if direct client contact is anticipated. Goggles are not necessary unless the nurse anticipates the splashes of blood, body fluids, secretions, or excretions may occur. Shoe protectors are not necessary. All right. I hope this picture, this visual, will help you in, remembering the concept of your contact precautions. Let's proceed. Naku, malapit na tayo. Question number 15. Nurse Oliver is caring for a client with impaired mobility that occurred as a result of a stroke. Excuse me. The client has right-sided arm and leg weakness. The nurse would suggest that the client use which of the following assistive devices that will provide the best stability for ambulating. Anong assistive device ang i-advise mo sa client na merong diagnosis ng stroke at merong right-sided arm and leg weakness? Assistive device, ha? Is it A, crutches? Is it B, single straight-legged cane? C, quad cane? Or D, walker? Your 5 seconds starts now. Time's up. The answer is quad cane. Ito po, quad cane. Yan. Now, crutches and walker can be difficult to maneuver for a client with weakness on one side. A cane is better suited for a client with weakness of the arm and the leg on one side. However, the quad cane would provide the most stability because of the structure of the cane and because a quad cane has 4 legs. All right, let's proceed. Question number 16. A male client with a right pleural effusion noted on a chest x-ray is being prepared for thoracentesis. Thoracentesis, ha? The client experiences severe dizziness when sitting upright. To provide a safe environment, the nurse assists the client to which position? Positioning to. Although mapapansin mo, ha, karamihan sa mga board exam type of questions, bibigyan ka nila ng storya, minsan paliliguin ka nila sa mga diagnosis, ganyan. Pero ang tanong lang naman talaga, kagaya nito, ay positioning. Positioning na gagawin mo kapag i-prepare mo siya sa thoracentesis. Ano bang position? Is it A, prone with head turned toward the side supported by a pillow? B, Sims position with the head of the bed flat? C, right side lying with the head of the bed elevated 45 degrees? Or D, left side lying with the head of the bed elevated 45 degrees? Your 5 seconds starts now. Time's up. The answer is letter D. Left side lying with the head of the bed elevated 45 degrees. Why? To facilitate removal of the fluid from the chest wall, the client is positioned sitting at the edge of the bed, leaning over the bedside table with the feet supported on a stool. If the client is unable to sit up, the client is positioned lying in the bed or in bed on the unaffected side with the head of the bed elevated 30 to 45 degrees. Malinaw yon? Malinaw. Board exam type of question number 17. Nurse John develops methods for data gathering. Nursing research to. Which of the following criteria of a good instrument? Instrument refers to the ability, definition of terms, nurses, ability of the instrument to yield the same results upon its repeated administration. Ito ang clue mo dito. Instrument, ability, dinidescribe sa'yo. Ability of the instrument to yield the same results upon the repeated administration. Is it A, validity, B, specificity, D, sensitivity, or D, reliability? Your 5 seconds starts now. Alam mo, sa board exam, nung panahon ko, ang daming lumabas na nursing research na tanong. Ang gigigil ako. Diyos ko. Pero ito na, sige, kagaya nito. So, board exam, batch ko kasi 2014, ganyan. Ako, dami 2013, dami purong nursing research. Ito na. So, the answer is letter D. Alright, why? Reliability is consistency of the research instrument. It refers to the repeatability of the instrument in extracting the same responses upon its repeated administration. Nako, nurses, tawag dito. Maaring, bago tayo mag-proceed sa next, maaring nagtatanong ka kung saan ko nakukuha itong mga tanong na to. Nakuha ko po to mula sa mga previous board exam natin sa Pilipinas. Ang mga nakaraang simula noong 2013, 2007 kasi naniniwala kasi ako at alam nyo yan na importante na medyo ma-familiarize tayo sa mga tanong na lumabas sa mga recent board exam kasi nauulit, diba? Sayang din yung isang points, ha? Malay mo yung isang points na yun na ikapapasa mo. Diniscuss ko siya dito sa mga video ko na discuss natin. Di sana nakinig ka, diba? Alam mo na, kaya makinig ka. Have a full grasp of the rationalization. Kaya kahit palit-palitin yung tanong o yung choices, alam mo kung anong sagot. Gigigil ako sa'yo. Question number 18. Harry knows that he has to protect the rights of human research subjects. Which of the following actions of Harry ensures anonymity? Anonymity. Ano mga gawain ni Harry ang nag-i-ensure ng anonymity? Nagpapakita ng anonymity. Ano yung anonymity? Anonymity, anonymous. From the root word anonymous. Ano yun? Unknown. A. Keep the identities of the subject secret. B. Obtain informed consent. C. Provide equal treatment to all the subjects of the study. Or D. Release findings only to the participants of the study. Your 5 seconds starts now. I kind of give away the answer there. And it's okay. Alright, time's up. The answer is letter A. Secret, unknown. Keep the identities of the subject secret. Keeping the identities of the research subject secret will ensure anonymity because this will hinder providing link between the information given to whoever is its source. So A is the answer. Number 19, a patient refusal to divulge information is a limitation because it is beyond the control of Tiffany. What type of research is appropriate for this study? Kapag refusal to divulge information ang sitwasyon mo, tinatanong ka kung anong appropriate research type of study ang gagamitin mo. Is it A, descriptive correlational, B, experiment, C, quasi-experiment, or D, historical? Diba? Pupupugin ko kayo ng mga nursing research questions. Your 5 seconds starts now. Maaaring nagtatanong ka, fundamentals of nursing, bakit may research? Yes, nursing research is one of the fundamentals of nursing. Huwag kang ano dyan. The answer to this is letter A. Descriptive correlational. Descriptive correlational study is the most appropriate for this study because it studies the variables that could be the antecedents of the increased incidence of the nosocomial infection. Alright? Let's proceed. Malapit na tayo. Galaw-galaw. Hinga-hinga. Ngayon, bago tayo mag-proceed, inaanyayahan kita na mag-subscribe ka na sa channel ko. Hit mo na yung notification bell kasi sisiguraduhin ko sa iyo na marami ka matututunan dito at para ba mag-enjoy ka dito sa channel ko, okay? Sisikapin ko rin na mag-upload nitong maraming test banking bago dumating yung Mayo para naman may magamit kang reviewer mo. Magtatanong ka sa akin, paano ko ba magagamitin tong educational material na ina-upload mo? Ganito mo siya gagamitin. Kung ikaw ay nagbabiyahe ka, mga ganyan, bago ka matulog, pakinggan mo tong rationalization. It doesn't have to be like habang nagluluto ka, panoorin mo, pakinggan mo yung beautiful, gorgeous voice ko. Tapos, enjoyin mo yung mga visuals nitong ating kasi nakakatulong to para sa mga auditory and visual learners natin. Be flexible, be creative. Ito namang aking ginagawang nursing educational videos ay para sa iyo. So, it's up to you and how are you gonna apply it to your daily life. Oo, mahalaga kasi na minsan minsan kahit pagtulog mo, pag ginagamit mo to siya, yung subconscious mind mo habang naririnig niya yung concept kahit natutulog ka. Pagdating ng araw ng board exam, yung instinct mo, that's your subconscious mind talking, okay? Alright, so board exam type of question number 20. Last 5 questions na. Nurse Ronald is aware that the best tool for data gathering. Ano ang best tool mo for data gathering? That's the question. A, interview schedule. B, questionnaire. C, use of laboratory data. Or D, observation. Your 5 seconds starts now. Time's up. Di ba ang daming nursing research question? The answer is letter C, use of laboratory data. Why? Incidence of nosocomial infection is best collected through the use of biophysical measures, particularly in vitro measurements. Hence, laboratory data is essential. Let's proceed. Monica is aware that there are times when only manipulation of study variables is possible and the elements of control of randomization are not attendant. Which type of research is referred to this? Type of research na gumagamit ng manipulation of study variables. Is it A, field study, B, quasi-experiment, C, Solomon 4 group design, or D, post-test only design? Your 5 seconds starts now. Time's up. The answer is letter B. Quasi-experiment. Now, this is done when randomization and control of the variables are not possible. So, kapag hindi possible ang randomization or ang ating, control of the variables, quasi-experiment ang gagawin mo. Okay? Let's proceed. Cherry notes down ideas that were derived from the description of an investigation written by the person who conducted it. Which type of reference source refers to this? Notes down ideas that were derived from the description. Is it A, footnote, B, bibliography, C, primary source, or D, endnotes? Your 5 seconds starts now. Time's up. The answer is letter C, primary source. Ito na nga, oh. So what is primary source? This refers to a primary source which is direct account of the investigation done by the investigator. In contrast to this is secondary source which is written by someone other than the original researcher. Alright? Let's proceed. Gusto kitang i-congratulate kung nakaabot ka sa dulo nitong video na to. Ang sipag mo, pagnanalangin ko talaga na makapasak, ha? Maraming salamat sa pakikinig, ha? Now, let's proceed. When Nurse Strix is providing care to his patient, she must remember that her study is bound not to doing any action that will cause the patient harm. This is the meaning of bioethical principle, not to do any action that will cause the patient harm. That's your clue. A, non-maleficence. B, beneficence. D, justice. D, solidarity. Your 5 seconds starts now. Jurisprudence. Time's up. The answer is non-maleficence. Hindi si Angelina Jolie ha, gigigil ako sa iyo. Non-maleficence means do not cause harm or do any action that will cause any harm to the patient or client. Ano naman yung beneficence? To do good, okay? That's your beneficence. But do no harm, that is your non-maleficence, alright? Let's proceed. Last two questions. When a nurse in charge causes an injury to a female patient and the injury caused becomes the proof of the negligent act, the presence of the injury is said to exemplify the principle of presence of injury caused by negligent act. What is that? A. Force majeure. B. Responde superior. C. Res ipsa loquitur. Or D. Holdevore doctrine. Your 5 seconds starts now. Time's up. The answer is res ipsa loquitur. Res ipsa loquitur literally means the thing speaks for itself. This means in operational terms that the injury caused is the proof that there was a negligent act. Negligent act na merong injury na nagko sa pasyente mo, may proof. Ito yung term mo, proof. That's res ipsa loquitur. Last question na tayo, nurses. Yay! Nurse Mirna is aware that the Board of Nursing has quasi-judicial power. An example of this power is example ng quasi-judicial power. A. The board can issue rules and regulations that will govern the practice of nursing. B. The board can investigate violations of the nursing law and code of ethics. C. The board can visit a school applying for a permit in collaboration with CHED. Or D. The board prepares the board examinations. Your last question. Give it your all. Your 5 seconds starts now. Time's up. The answer, nurses, is what? Letter B. The board can investigate violations of the nursing law and code of ethics. Quasi, discuss natin to. Ano ba yung quasi-judicial power? Ang ibig sabihin nito is the Board of Nursing has the authority to investigate violations of the nursing law and can issue summons, subpoena duces tecum as needed. Okay? Yehey! Yehey! Thank you so much. Tapos na nga tayo sa ating discussion. Please like, share, and subscribe to my channel for more nursing educational videos. Abangan nyo po yung next video natin ha. Huwag nyo pong kakalimutan yon. Let me know if you have other nursing topics and nursing discussions that you want me to create for you. Put it down on the comment section below. Kung nakaabot ka hanggang sa dulo nito video na to, maraming salamat. I congratulate you. Isa kang bayan. Medyo lengthy kasi ito eh. Ngayon, dahil nga board exam to, gusto ko malaman kung anong score mo, pakilagay yan sa comment section sa baba. But I want you to understand na sa ginagawa nating test banking, nire-rationalize natin, hindi importante kung gaano kataas yung score mo, kung na-perfect mo yon. That doesn't really matter to me. Well, that's a good point. That's a good start, but I really want you, kung mababa yung score mo, huwag ka mapapanghinaan ng loob, boy or girl. Kasi ang purpose na itong rationalization natin ay para maunawaan mo kung bakit yun yung sagot. Para pag nauli siya sa board exam, alam mo na. Kahit pa ikot-ikutin, iba-ibang forma, alam mo na kung anong isasagot mo. Naintindihan mo? Huwag ka mapanghinaan ng loob, laban lang, pusuan mo lang yan. Tulungan mo na nga ako, ipamalitan mo na sa radyong sila ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube.
Thank you so much, nurses, for watching. Hope you learned something. Helping grow my channel. You are already here. You might as well subscribe. Hashtag Team Kulto. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists and videos I created for you. I'll be putting the links on the description box or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gabe except for my TikTok account, which is Neil Gabe Official. I also invite you to please join our Facebook page. I'll be putting it here. The link is on the description box, okay? I'll see you guys next time. You have a good one.